Thank you all for coming. We appreciate for this update on the coronavirus situation here in the state of Delaware. First of all, I want to recognize and thank Dr. Odom Walker, the Secretary of Health and Social Services, and Dr. Carol Rote, the Director of the Division of Public Health, and for their teams for really the incredible work that they've been doing day in and day out over the last several weeks. I visited the State Health Operations Center just the other day and saw all those state employees with their noses to the grindstone, their heads down, working on this very serious matter. I want to also thank the Lieutenant Governor for being here and her support, and A.J. Shaw, who's heading up the team at DEMA and at the Operations Center. I know it feels like things are changing every minute, and in many ways they are. It seems to be a minute-by-minute, day-to-day proposition. And we're trying to get information out to the public as quickly as we can. And we appreciate everyone's patience as we work through a situation that's really unprecedented in any of our lifetimes. We are clearly operating in uncharted waters. Today, to that end, I met via teleconference with AJ and Secretary Odom Walker with town officials up and down our state, Sussex County, Kent, Newcastle County, the city of Wilmington, with our school superintendents, and with the leaders of the hospitals across the state of Delaware. As I've said all along, it's going to get worse before it gets better. And that's why we're working with the hospitals to develop a statewide testing plan that's being stood up this week and coordinated across all 3 counties. That testing plan will give us a better idea of where we stand in our effort to, as they say, flatten the curve, meaning to reduce the spread of this virus. All the restrictions we've implemented to date have been geared towards flattening that curve, and in doing so, protecting all Delawareans. On Monday, I made the very difficult decision to close restaurants and bars in Delaware just before one of the busiest times of the year until it is safe to reopen. Today, we're adding movie theaters, bowling alleys, concert venues, and gyms to that list. Non-essential social gatherings over 50 people need to be canceled immediately. Businesses that are open to the public need to make sure that no more than 50 people are close together in the same space at the same times. And as you know, we've closed our schools. I'd like to really thank the school superintendents and their teams who have worked hard to make sure that we can continue to provide meals for thousands of children across our state and to find a way for them to continue to have those students learn during this crisis. For anyone out there who doesn't think this is serious, I hope that our actions over the last few days have indicated how wrong that thinking is. I am acutely aware of how seriously this is affecting thousands of business owners and their employees across our state. I've spent my first 3 years as governor trying to expand business in Delaware. And so it pains me to be in a position to have to shut them down at this time. I'm particularly concerned, as they are, about the effect of these closings on the employees who depend on that business for their livelihood, raising their kids and supporting their families. And that's why I've asked Secretary of Labor, Saran Cade, to find ways to assist these workers while the restaurants are closed. Today and yesterday, we announced a series of steps to provide relief to these workers and businesses during the course of this crisis. The Department of Labor will begin processing unemployment claims as they are received, with the goal of benefits becoming within a week. Employees earning part-time income can collect benefits as long as they demonstrate decreased hours and earnings. And that's important. the Department of Labor will not classify tipped employees as minimum wage earners as long as their tips are reported as wages. Again, an important group of employees and workers across our state. We've created the Hospitality Emergency Loan Program, which will provide no-interest loans capped at $10,000 per business per month. The goal is to keep restaurants and bars afloat so that they can reopen when this crisis has passed. We announced today that restaurants and bars offering takeout service can also sell alcohol to go with their food orders. And I would encourage all Delawareans to do as I have the last 2 nights and order food from those takeout services. Before this crisis is over, we will see other industries shaken as well. And our normal way of life will be altered in a very serious and significant way. We will do our best to help everyone in our state, every business, every employee through this, and we will get through this. The best thing that we all can do through this crisis is to flatten the curve, to reduce the spread now on the front end, and try to shorten the time when the virus will be tearing through our country. The best way to do that is to follow the hygiene advice you've heard 100 times. But we need everyone to pitch in and follow that advice. The guidance is pretty clear. Wash your hands over and over again. Cough into your sleeve if you're coughing. If you are sick, even if there are mild symptoms, you need to stay home and avoid social interaction to the great extent possible. And more importantly, as importantly as all this, protect that population that is most at risk, and those are our senior citizens and those with compromised health situations, our grandmothers and grandfathers, our moms and dads. I check in with my mom every day to make sure she's staying put at home. She's not out visiting one of my younger brothers who was sick, and she's following the rules. When your brother's sick and mom wants to take chicken soup to her, it's a tough conversation to tell her to stay home. But that's the kind of conversations that we all need to have. And so if we follow these rules and we stick together, as we do here in Delaware when we have big problems, we will get through this. I would again thank Dr. Odom Walker for her tremendous leadership, Dr. Rattay and A.J. Shaw for their leadership, and for the work of their teams. One of the things that we've been focused on as we've talked to the hospitals and others is the need to protect our first responders from the virus and our healthcare professionals and workers. We need them safe and we need them well in order to deliver the services that they do so well in our state. And so with that, I'm going to turn it over to Dr. Odom Walker.
Thank you, Governor. As we said this morning during a live stream update, it truly is a challenge and a profound shock to our normal sense of being. It was only 7 days ago when we announced the first coronavirus case in Delaware, and since then we now have increased numbers, and Dr. Rattay will go through our current situational update. But in those 7 days, our life has drastically changed, from the way we do our jobs to the amount of time we spend in our homes, secluded from others. This coronavirus has quickly and comprehensively changed the way we live our lives. And as I said this morning, I'm asking everyone to do more. We need to act as if we might be carrying the virus. That means the normal things that we do, we need to make sure that we're protecting those vulnerable populations, particularly our seniors and people with underlying medical conditions, our healthcare workers, our first responders. For most of us, if we get COVID-19, we might feel a little sick, but we'll recover, we'll be fine, we'll go home, we'll take some Tylenol, we'll take some medication we normally take, and recover. But seniors and people with heart disease, lung disease, and diabetes are at increased risk. Those individuals who have suppressed immune systems are at risk, and we have to protect them. We collectively have to support our communities and protect them, because coronavirus is 10 times more deadly for these vulnerable populations, and even more for the oldest of our communities. We also know, as we go into this, where we're peaking hopefully sooner than later, we must protect our healthcare workers and first responders, and we can't afford to lose them from the essential work that they do. So for all of these reasons, we need to really be cautious about where we are, whether we're out in public, whether it's necessary, because we might unknowingly transmit the virus to the vulnerable people, healthcare workers, or first responders when we're feeling just a little bit ill. We don't have much time left to flatten this curve, and so we are focusing right now on two primary messages. If you are well, practice social distancing. Protect yourself and your loved ones. That means staying 6 feet away from people, avoiding large gatherings. Certainly, we want to make sure that we are protecting each other. Our second recommendation is this: if you are sick, you have symptoms, a fever, a cough, stay home. And definitely call your primary care provider to talk about symptoms. Please do not rush to the emergency room unless you are having an emergency. Those symptoms could include, as I mentioned, cough, fever, shortness of breath, but we definitely want to protect those at elevated risk. And everything we do now is to make sure that people are staying out of the hospital beds that we need, out of the ICUs, and truly staying away from contact with confirmed cases. We are going to talk about a plan to make sure that we have testing available, and I am so proud that Dr. Rattay is leading the team that's tracking the spread of this virus, but also will give us an update on the current number of cases and some information that may be important if you have questions or want to find out more information. Dr. Rattay.
Thank you so much, Governor Carney and Secretary Odom Walker. So I do have an update in regards to our cases. We now have 26 positive cases in Delaware. 20 are Newcastle County residents, 3 are from Kent, and 3 are from Sussex. Most all of these individuals are self-isolating at home and doing fine. That's 23 individuals who are at home. However, 2 are hospitalized in Kent, and sadly, one of those individuals is in critical condition, and 1 individual is hospitalized in Newcastle County. The age range of these individuals is 18 to 80. I want to talk a little bit about testing. The increase in numbers that we're seeing is reflective of increased infection, but it's also a reflection of increased testing that took place in Delaware over the last week. As we had discussed, in addition to the Division of Public Health Laboratory being able to do testing, a number of commercial labs are now able to do testing. And so many Delawareans were tested over the last week. These results indicate a reflection of increased testing. That being said, we know that there are additional Delawareans who should be tested. So who should be tested? Those individuals who have the symptoms that Dr. Walker was talking about, with fever or cough or shortness of breath. So symptomatic people should be tested for COVID-19. Now, there is prioritization, so it's very important to us that those who are most ill, like those who are hospitalized, are tested, as well as those who are in the highest risk groups, like those over age 60, as well as those with chronic underlying conditions. But also, as it's so important that we protect our first responders and healthcare providers, any of those individuals with symptoms, we want tested right away. We are so grateful to live in a state where we have such amazing healthcare providers, and we are very excited to be partnering with our healthcare providers, especially our hospitals across the state of Delaware, to develop a system of testing where Delawareans who need to be tested will have access to testing throughout the week. So over the upcoming days, you will hear a lot more about this testing access so that all individuals, whether it's healthcare providers or the public, is aware of how do you get tested if you need to be tested. So as I close, I want to really echo what Governor Carney and Dr. Odom Walker said, that we really implore all Delawareans to distance yourself from other people. Make sure that you stay at least 6 feet away from other individuals. And please, if you are ill, do not leave your home. And if we all work together on this, we can bend the curve. Thank you.
Thank you, Dr. Rattay and Dr. Walker, and now we'll be available for some questions.
Do you feel that Delaware has enough hospital beds and ventilators to deal with the crisis?
That is certainly something that we're looking at. It's part of the plan. AJ is heading up a little working group working with the hospitals to identify that and anticipating that at some point we may need so-called surge capacity. We're looking at the possibility of standing up hospitals outside of the regular hospitals, if you will, to allow for that capacity. It is a big concern among all the governors on our call this morning or this afternoon, the availability of ventilators, the availability of extra beds, the availability of protective equipment and testing. So that's one of those things that AJ is working on with a working group, a group that includes the hospitals and other officials.
And are there any projections of how many people could be infected in Delaware? Is that something that the state looks into?
Yeah, I'll turn that one over to Dr. Rattay or Dr. Walker. We are trying to come up with some certain scenarios to figure that out. Obviously, you want to try to figure out how much surge capacity you have currently in the hospitals and how much you can free up or make available. They have the ability to free up some of that capacity, and they're looking at and taking some of that action, like curtailing certain unnecessary surgical procedures. You've probably heard about that. And then we've got to figure out what kind of space we can make available outside the hospitals. Dr. Rattay or Dr. Walker?
I think this is one of the many unknowns. What we know is that if we take certain actions, we are able to reduce the number of people who require hospitalization or ICU beds and stays. And so that's why it's critical to look at the closures and social distancing measures. We know that if we don't do those things, the rate of infection could be 30 times more than what we're seeing now. A 30% increase with an exponential trend could be out of control quickly. And so that's why it's so important that we're taking the actions we have in place today. But it is certainly an unknown that we're watching very closely.
And so I don't think we can emphasize enough that term of flattening the curve, because you want to try to keep that as low a number as possible, because once it starts to explode, it increases exponentially, and that's where you end up with a problem on the back end. And that's why AJ's team is looking at those facilities and standing up those facilities outside of the hospital places.
Is there a sense at this point how quickly test results are being returned around to people? How long it's taking people to learn whether or not they're been contaminated?
Sure. So in our public health laboratory, we're able to turn test results around within 24 hours. When test results are going to commercial labs for less urgent cases, the turnaround can be 3 to 4 days. The expectation is that will decrease over the coming days and weeks, but that is the status right now.
Christiana Care did 536 tests Friday. Have they all those tests been evaluated? And
We've got those results back, yes, and I think
so the 25 incorporates all the 536 tests. How many negative tests have you had? I noticed you're not releasing that anymore. Can you say?
We are trying very hard to keep track of the negative tests, but that has become more challenging as the data the data collection system is not fully built, and quite frankly, now there's about 15 different laboratories that are doing these tests. So we are working on that, but we don't have a total number at this point that are being tested.
Instead of doing 536, you only have 25 total. Fair to say more than 500 negative tests, if you say they're all incorporated.
Absolutely. So another way to look at that is actually among the people tested, of which there were 536 tested, it was around 2% that were positive, and all those individuals that were tested had the symptoms. So that actually tells us it's a relatively low rate right now, and that is a number that we will absolutely keep looking at.
Can I ask you a question about symptoms? Earlier you used the word "or" when talking about the symptoms. So you said if you have a fever or other symptoms. So if you have a fever only, should you be tested? If you have a cough only?
If you have a fever and cough or shortness of breath. So the "or" goes between cough or shortness of breath. You have to have one of those two, but you need a fever.
Is there any indication that the schools might have to stay closed longer since today information came out that people associated with schools tested positive?
Well, I think it's fair to say on the call that we had with the superintendents today that we were looking at a scenario where they're closed for 2 weeks. That we need to start looking at scenarios where they're out for longer than that. Not related to that particular those particular tests, but just the idea that we're getting more of this spread. That's likely that we're looking at more than 2 weeks. Initially, the 2 weeks was decided upon mostly because, in the first place, the CDC wasn't recommending necessarily closing the schools, but we needed to provide some time for the superintendents and others to figure out how they would operate without bringing the children into the schools in terms of feeding children, and they did a really nice job with that in terms of getting instruction to the children remotely, and they've been working on that. But we're probably looking at something beyond that. Going back to Chris's to the math, well, he left. Where'd he go? Going back to your math, and maybe you were getting that. You know, of the 536, 11 were positive. Some of those were out-of-state tests, as I mentioned to you earlier. I think of those 11, I think 7 were Delaware tests. To give you some idea of the math.
So there's only 7 from that group, and our total of 26. Keep it straight.
Of 500, and yes.
Yes, correct.
Governor, aside from the sickness itself, a lot of people's concerns are toilet paper, meat, things like that. Obviously, the demand is spiked. Is there any thought about, making it, if you're A through F, you get to go to the grocery store this day? I mean, I know that sounds crazy, but there's nothing on the shelves in a lot of stores.
Look, nothing sounds crazy or out of the question at this juncture. What we're just encouraging people to do is just go and buy what you need. What we've heard from the president and the vice president and their task force is there's not a shortage of these things nationally, and they've been meeting with the big chains and the grocery stores and the rest. But if people go in there and buy a month's supply, then it's going to make it more difficult for the other people to go in and get next week's paper products or the like. So that's our message. On our phone call with the town officials, they were seeing that in particular in the southwestern corner of our state, in the Laurel, Bridgeville, Seaford area, and some of those stores. And so it's a little bit episodic across our state from the reports we were getting back from the town officials.
So the businesses downtown have been closed. Will any of the state offices be closing or closed to the public?
So we are working on all of those pieces, the public-facing services that are provided by the state. The DMV has come out with a whole series of things that they're doing. They're taking tolls just electronically, no exchange of money. Same thing with operations inside. Same thing here in the Carville State Office buildings with respect to the folks that deal with the taxes and revenue. We're not talking about we're trying to get as many people as can that can operate remotely, and we'll take that as at a day at a time in terms of the advice to all those folks.
If the schools continue to be closed longer than the 2 weeks, will teachers still be paid?
Yeah, my understanding is that they will continue to get paid, and that's why we're trying to get some instruction, remotely, and to accomplish some of the other things that we need to get done. One of the big issues that we've heard from the hospitals is getting hospital personnel or personnel to maybe take some of the burden, administrative type burden, off of the healthcare professionals themselves. And so that's something that we're looking at too, and an important thing as we move forward. Okay, thanks very much for coming.
Teacher at the Red Clay School District who tested positive?
I don't know.
That was on WDEL? That's
We
Tested positive at Cat
okay.
yeah, we can't get into particular cases like that, but
Is that because of HIPAA?
yes, in
How
part.
how many cases you associated with UD now? That's either been the epicenter of the first week.
I think it's the same that we ended up with. I mean, it's hard to
Is that
say.
spider webbing out at all, or is it?
I can't answer that at this point. We can get back to you.
But it's officially community spread at this point? Or are cases still being investigated?
Cases are still being investigated. We do have some cases where our initial investigation has not demonstrated a source of infection, but we are still investigating.
Any state employees self-quarantine at this point? As far as you know?
Not that I know of. All right, thank you very much. Thanks for coming.